Hello everyone, in this lecture we'll be dealing with adenoids. Contents of this video are definition, etiology, clinical features, diagnosis and treatment of adenoids. Definition: these nasopharyngeal tonsils, which are covered with ciliated columnar epithelium, are situated at the junction of roof and posterior wall of nasopharynx. What are adenoids? They are nasopharyngeal tonsils covered with ciliated columnar epithelium. The situation: junction of roof and posterior wall of nasopharynx. You can just have a look at this picture, you'll get a clarity. Roof and posterior wall of nasopharynx. Adenoids are composed of vertical ridges of lymphoid tissue separated by deep clefts. As you can have a look at the picture here, there are vertical lines, the ridges. They are separated by deep clefts in between. So adenoids are composed of vertical ridges of lymphoid tissue separated by deep clefts. Adenoids have no crypts and no capsule, unlike the palatine tonsil. There is a comparison made. Palatine tonsils have crypts and capsules, whereas adenoids no crypts, no capsules. Adenoid tissue is present at birth, show enlargement up to the age of 6 years and disappear by the age of 20 years. Adenoids are subject the etiology. Adenoids are subject to physiological enlargement in childhood. As we saw in the previous slide, they are present up to the age of 6 years, which means there is a physiological enlargement in childhood. Certain children have a tendency to generalized lymphoid hyperplasia in which adenoids also take part. There are certain children in which there is hyperplasia of lymphoid tissue, of generalized, which means all the lymphoid tissues of the body, there is increase in the number of cells. In the same way, adenoids also take part and there is enlargement. Recurrent attacks of rhinitis, sinusitis, chronic tonsillitis may cause chronic adenoid infection. When a person is having again and again recurrent attacks of rhinitis, sinusitis, chronic tonsillitis, they will lead to chronic adenoid infection. Allergy of upper respiratory tract may also contribute to the enlargement of adenoids. Clinical features: they are divided into 3 types: nasal symptoms, oral symptoms, general symptoms. Nasal symptoms: nasal obstruction, nasal discharge, sinusitis, epistaxis and voice change. Here we'll be dealing with each of them. Nasal obstruction, it is the commonest symptom. It leads to mouth breathing. Nasal obstruction also interferes with feeding or suckling in a child, as respiration and feeding cannot take place simultaneously. So whenever there is nasal obstruction, the baby cannot breathe. It has to breathe from the mouth. Then when the baby suckles the milk, it cannot breathe, as both the breathing and suckling takes place from the mouth. Both cannot take place simultaneously, so there is a difficulty in children. Nasal discharge, it is partly due to choanal obstruction, as the normal nasal secretions cannot drain into nasopharynx, and partly due to chronic rhinitis. The child often has a wet bubbly nose. Whenever there is choanal obstruction, the normal secretions which has to drain into the nasopharynx in turn come out from the nose. They start dripping from the nose. and this may also occur due to chronic rhinitis. As a result of this, the child will have a bubbly nose. Sinusitis. A primary maxillary sinusitis may lead to infected and enlarged adenoids. Whenever there is maxillary sinusitis, that will also be a cause for the enlarged adenoids. Epistaxis. When adenoids are acutely inflamed, epistaxis can occur with nose bleeding. Whenever the adenoids are inflamed, the person on nose blowing, they start bleeding from the nose. Epistaxis occur. Voice change. Voice is toneless and loses the nasal quality due to nasal obstruction. These will be the nasal symptoms. Oral symptoms. Tubal obstruction. Adenoid blocks the eustachian tube, leading to conductive hair loss. In the tubal obstruction, the adenoid will block the eustachian tube. As a result, there will be conductive hair loss. Recurrent attacks of acute otitis media may occur due to a spread of infection via eustachian tube. From the adenoids, the infection spreads via the eustachian tube and acute otitis media occur. Chronic suppurative otitis media. These things fail to resolve in the presence of infected adenoids. Whenever a person is suffering from adenoids, the chronic suppurative otitis media fails to heal. Adenoids form an important cause of otitis media with effusion in children. The general symptoms: adenoid facies, chronic nasal obstruction and mouth breathing lead to a characteristic facial expression called adenoid facies. Whenever there is a nasal obstruction and the person or the child breathes through the mouth, it leads to a certain characteristic appearance on the face. The child will have an elongated face and dull expression. The mouth of the child will be open. There is prominent and crowded upper teeth and a hitched up upper lip. As you can see the picture of the baby or the child given in the slide, the baby has an elongated face, the teeth are crowded, the lip is a hitched up lip, and the mouth is open. Nose gives a pinched in appearance due to a disuse atrophy of alveoli. As the person always breathes through the mouth breathing happens, so the nose is not in the use. As a result, there will be disuse atrophy of alveoli. High arched hard palate. When you examine the child, there will be high arched hard palate. Long-standing nasal obstruction due to adenoid hypertrophy can cause pulmonary hypertension and cor pulmonale. Aproxexia. Aproxexia means lack of concentration in children. Diagnosis can be seen with a mirror. When you examine the postnasal space in the young children, the adenoid mass can be seen with a mirror. Nasopharyngeoscope. A flexible or a rigid nasopharyngeoscope is useful to see the details of the nasopharynx in a cooperative child. Radiograph. The soft tissue lateral radiograph of the nasopharynx will reveal the size of the adenoid and also to which extent the nasopharyngeal airspace has been compromised. Treatment: breathing exercises, decongestant nasal drops, antihistaminic, adenoidectomy. When the symptoms are not marked, you can give breathing exercise, decongestant nasal drops to the patient. Antihistaminics for any coexistent nasal allergy can cure the condition without resort to surgery. When the symptoms are marked, when you cannot deal with the breathing exercise and drops and everything, then you have to go for adenoidectomy. Indications and details of operation will be discussed in the operative surgery. Thank you.